Please welcome Dharma into Action Foundation, President Shekhar Narasimhan.
I am Shekhar Narasimhan, the president of Dharma into Action Foundation. Thank you to all the volunteers who made this event possible, especially Parag, Vaibhav, and Mitra. Dharma into Action was created to catalyze the 4 traditions emanating from India that are prevalent across Asia and now across the world. We must show the relevance of our traditions in America. And it feels like we were created for just such a moment when action is needed and it must be scalable and coordinated. We are very grateful to our amazing expert panel and to all of you for spending part of a Saturday afternoon on a matter that is deeply personal to many of us. When the panel concludes, we will have officers from the Indian Embassy to answer questions, and then we move into a more intimate and private breakout. We invite you to stay so we can each decide what else we can do to help at this time of great need for India, Nepal, and Bangladesh. I'm going to hand it over now to Mitra Kalita for the first panel discussion. She is a veteran journalist, media executive, and author of 2 books. She is now the co-founder and CEO of URL Media, a network of Black and Brown community news outlets that share information and content. Mitra, all yours.
Thank you, Shekhar. And I think it's worth letting the folks gathered here know that I've known you for almost 2 decades now. And it didn't surprise me in the least that in the moment I feel like our community needed this most, that you reached out and asked me to do this. So it's an honor to be with all of you today. Thank you so much for spending your Sunday, regardless of where in the world you are with us. I want to say that it's been a very difficult time for our community, and most of the time when I'm on Zoom calls, I'm able to separate the WhatsApp messages and the status updates from my own family in India, mostly in Assam, but also in Delhi, Bombay, and Bangalore, who've been dealing with COVID. And somehow I'm able to put myself together to get on a Zoom call and talk about, my 3-year budget plans and my startups, and the work that I'm doing is somehow separate from what is really preoccupying my mind these days. And I think that's the case for many of us who gather. Just from the questions we've gotten from the crowd, this panel clearly has struck a chord again at a time that it was most needed. What I want to encourage all of you to do is 2 things. One, to put your questions in the chat. We will continuously monitor that to make sure that we are weaving your concerns and your perspectives into today's discussion. And then, as Shekhar himself alluded to, this just being the beginning of discussion and dialogue. And hopefully today we will get a number of ways to stay connected and to continue to effect change on this very important issue. So the format today, we're going to hear from some experts, a mix of on the ground and the business community, and then of course the scientific grounding of it all. And then we'll have a fireside chat with our Surgeon General, and then we'll open it up for another discussion. I am, again, as I said, very honored to be here for all of it, but I did want to acknowledge that this is combining many parts of my world on a Zoom call, and I'm going to try to keep it together, but this definitely is an issue that's really hitting close to home. I did want to begin, I mentioned kind of grounding us in the science, and our first panelist is Dr. Ali Mokdad. He's the professor of health metric sciences and serves as chief strategy officer for population health at the University of Washington. Prior to this role, he worked at the CDC and has published groundbreaking research on local level disease trends and leading risk factors for poor health. So very much an expert in this space. Dr. Mokdad, welcome. Thank you for being with us.
Thank you. Thank you, Mitra, and thank you, Dharma into Action, for having me to talk about the COVID-19 pandemic and epidemic in India. I have some slides to share with you, And please bear with me. This is a difficult presentation to make, knowing the conditions on the ground in India. If you can post my first slide, please. So I'm going to talk about the projections, COVID-19 projections in India. And the next slide, please. And give you a little bit background on the situation in India. COVID-19 was the leading cause of deaths in India the last week by a big margin. It's 2.8 times more than the second leading cause of deaths, which is usually cardiovascular disease in every country. India currently has the highest number of daily cases, COVID-19 and deaths compared to any country in the world. And last week, the daily COVID cases were about 4 times, and the daily COVID deaths were about 3.5 times compared to the week before. It was much higher the weeks before. The daily cases increased by 4% and the daily deaths by 12% since the last week. And without drastic measures to bolster the health system to deal with this surge by decreasing social mixing and increasing the effective use of masks, and of course, rolling out the vaccines as soon as possible, the situation currently looks quite grim for India. Next slide, please. And this is what we call effective R. This is the probability of somebody who's infected can infect somebody else. It's above 1 in 15 states. So in many states, the epidemic has peaked in India and it's coming down. But in 15 states, cases are still going up in India and will continue to go up in the coming couple of weeks. Next slide, please. India, due to lack of testing and the ability to test as many people as possible in India, because of the sheer numbers and the logistics that it would take to do the testing, is only detecting about 5% of the cases. So when you hear in the news 200 or 300,000 cases a day, please keep in mind that there are more cases that have not been detected or tested in India. Next slide, please. On the good side, mobility has decreased in India in response to the rising surge that we are seeing. So people in India are doing what it takes in order to decrease the burden of this pandemic and to decrease the surge by reducing their mobility. Next slide, please. And mask use has increased in India. It's almost 80%. It has been increasing. And again, that's a good thing that people in India are reacting to what's happening right now and doing what it takes in order to control this pandemic. Next slide, please. Our projections right now for cases in India, we projected that cases have peaked in India and they're coming down. Again, not in all states, as I showed you. We expect right now about 4.8 million cases on a daily basis, and it will be coming down all the way to September 1st. Cases have peaked around 15 million a day in the past, but they're coming down right now, which is very good news. Next slide, please. We're projecting by September 1st, 1.24 million deaths. Again, there is undercounting of deaths in every country in the world, here in the United States, so it's not an India issue. And of course, not all deaths are reported, and we expect by September 1st, 1.24 million deaths in India. Let me pause a little bit here. 1.24, these are fathers, not a number, mothers, sons, daughters, cousins, friends, relatives. So it's very important for all of us to pause and understand what's going on in India and how it is devastating of what's going on right now in India. Next slide, please. Case deaths, we expect that it's now peaking in India. It will be coming down all the way till September 1st, which is very good. As usual, when we have cases peaking, the death is 2-3 weeks later when it peaks because of the lag period between infection and mortality. But we're projecting in India that cases will keep declining all the way. Today actually is our peak, and it will be coming down all the way down. Next slide, please. The slide that has been very controversial, but from a scientific standpoint, I need to put it out there. Vaccines are effective against the old mutation. This is what they were designed for. Some of them are not effective against the new mutations, what we call escape variants. One of them is AstraZeneca. The studies that have been done in South Africa showed that effectiveness is very low against preventing infection and against the new ones, especially the new virus that's now circulating in India, it's about 6% in preventing the infection. So we strongly believe that AstraZeneca, unfortunately, is not going to help with the situation in India. And that's why you see a rise in cases in India, even after the vaccination campaign, although it's going slowly. Next slide, please. So the public health message continues to remain the same. Basically, isolate, stay at home, wash your hands, wear your mask, stay away from each other. Prevention, prevention, prevention. That's what we need. If you please wear a mask and update your mask, upgrade your mask, make sure you have the right mask. Next slide, please. And the main thing right now in India, in order to contain this virus, is to do sequencing, to know what kind of mutation is circulating in India. We know that the rise in India was due mainly to the circulation of the mutation that came from the UK, but there was a homegrown mutation, B1617, which is an escape variant, and we have two of them right now, 1 and 2. So it's very important for India to do as much sequencing to know what kind of mutations are circulating in the country. That's 1. 2, to also check the vaccine efficacy against these mutations. So that's very important for all of us to know, and for the whole world to know, especially with the new escape variants that are surfacing right now, especially in India and other places in the world. And my last slide, I would like to end up with the following. India is in a dire situation right now. So the whole world is. I want everybody to understand what's happening in India right now will determine the course of the pandemic globally. There are potential for new variants that are coming up in India. There is a heavy dust and toll on India right now. And please remember, it's not right now what we need to help India. There is a long-term effect on health. And India needs our help after CNN and all other news leave India, because this disease is devastating and will have a long-term impact on the economy and the health of Indian people. There is a global impact. We're not safe. There is vaccine production. A lot of things are produced in India, and this will impact global stability. And we're not safe here in the United States. We're not safe in the United States until everyone else is safe, until Indians are safe. And I want to make sure that our leadership here, our politicians understand that we need to step up and help India immediately, Nepal and all the countries in the South Asia. Thank you very much.
Dr. Ali Mogdad, thank you so much. That was super, super informative. We're going to turn for a view from the ground, and I begin my introduction of Dr. Gagandeep Kang with a thank you for staying up. It is very late in India right now, and we're so grateful to have you among us. Dr. Kang is a fellow of the Royal Society and a professor of microbiology at Christian Medical College in Vellore, India. She is known for her interdisciplinary research studying the transmission, development, and prevention of infections among children. She is a renowned public health expert, and we're very grateful for her expertise. Dr. Kang, I turn it over to you.
Thank you very much for the invitation to join you here today. Ali has presented a picture that seems really dire, and it's true. We are in a bad way today. I'm in southern India, and the numbers are climbing here. The hospital that I'm at has currently 1,000 patients that are admitted in the hospital. We have another 450 patients that we are looking after at home. Our hospital is in a situation where we were very grateful to receive yesterday 175 oxygen concentrators, because even though we built 2 oxygen plants last year, we did not anticipate a surge of this magnitude. And I think in our hospital, we are better off than in less resourced places, particularly in rural India. From the alumni of our institution, from the people that we work with, everybody in the South and the East is struggling now, just as people in the West and North struggled a few weeks ago. Where are we in terms of being able to manage this pandemic? Well, the situation we're in right now is a challenging one, and we're just going to have to weather this storm as best we can. I think everybody who has relatives in India knows the difficult time that everyone has been going through. What could we have done that was different? I think there were a few things that perhaps we should have paid attention to. In terms of building up infrastructure in India, we have a 70-year history of ignoring healthcare or not investing in healthcare. As many of you will be aware, people who can afford to don't necessarily access government healthcare. And what has happened this time, very unusually, is that even people who could at other times afford to get the best of healthcare in India have been in a situation where private healthcare has also been overwhelmed, and it's been very difficult to find beds, to find treatments, and get what is really needed. Could we have prepared for the second wave better? Yes, of course we could have, but I'm not sure how much preparation would have been enough. Because when we talked about it, we expected something that was 2 or 3 times worse, not something that, as measured, is 4 times worse than the first wave that we saw. There's a lot that we don't understand, but again, as Ali pointed out, the features of trying to control the infection and its spread are things that were within our control. And both as the population and as leadership, there were missteps. And we are, in a sense, paying the price for that now. Will we learn from this? Will we do better? I certainly hope so. I don't want to ever see this again. I'll hand back to you, Mitra.
Thank you so much. Okay, we're going to turn to our own in the US, Nisha Desai Biswal. She's the president of the US-India Business Council and senior vice president for South Asia at the US Chamber of Commerce. Ms. Biswal provides strategic guidance and leads advocacy efforts on behalf of US IBC's more than 300 member companies, promoting long-term commercial partnerships to advance the bilateral trade relationship between the US and India. And it's certainly a group we have been hearing from in recent weeks. Nisha, I want to hand it over to you.
Thank you so much, Mitra. And just following upon the presentations and the overview provided by Dr. Muqdad and Dr. Kang, I would say that the business community probably started picking up the alarm signals, the early warning, faster in some ways than government, because US businesses, both through their operations in India, where employees were starting to sound the alarms about rising COVID levels, and through their Indian American and diaspora workforce in the United States, who were starting to hear concerns from family members in India. So the business community, I think, started mobilizing and raising concerns in the United States with the US government fairly quickly and early on. In fact, the US Chamber back in late April put out a statement calling on the United States government, the Biden administration, to release excess doses of the AstraZeneca vaccine and provide urgent assistance to India and other COVID hotspots. What you saw in those early days was just a outpouring of support from the private sector. And today, I think the tally stands that the private sector and private resources have mobilized over 400 million in assistance to India from the United States alone. And that's in addition to the 100 million that has been mobilized from the US government. what the companies have been doing is initially it was about all of their individual private contributions, whether, across the board, Google, Amazon, Walmart, Procter & Gamble, Pepsi, Coca-Cola, Accenture, IBM, Microsoft, you name it, every company that has significant operations in India mobilized in a large way to bring assistance and support. But immediately following the announcement of individual assistance, the companies came together with the chamber and said, the magnitude of this is such that we need a more coordinated response. And we launched, in partnership with the US Chamber and the Business Roundtable, with the US India Business Council and the US India Strategic Partnership Forum, we launched the Global Task Force for Pandemic Response. And here what we've been trying to do is really create a more effective public-private partnership that brings together the business community, the US government, the government of India, the NGO sector, to think about more strategically what are the major needs, what are the constraints, and how do we solve for those constraints. Fundamental to that, there's a supply chain problem. The oxygen supply chain, where we've seen that the need for oxygen and where oxygen is produced and supplied, there's a major constraint there. You have seen oxygen supplies flowing in from around the world. We at the Global Task Force, working with USISPF, have committed to 50,000, oxygen concentrators over the next month and a half. We have committed to and are providing over 1,000 ventilators into India to try to provide the needs in ICUs across India. But we're also looking beyond these urgent needs to say, as we see this pandemic continue to move around India and then into the region and beyond, how do we solve for that larger problem? Because there is a global supply constraint in the oxygen supply chain. There are constraints on therapeutics, on vaccines, and on PPE that need to be addressed. And we need governments and businesses working together to ensure that, one, production capacity is increased, two, the logistics of moving things from where they're produced to where they're needed are addressed, and three, working with the Indian government on distribution into those urgent needed areas, so that we're understanding in real time where needs are being met and new needs are being discovered. We also know that this pandemic is not going to stop at India's border. In fact, it's already a major concern in other parts of South Asia, in Nepal, in Bangladesh, in Pakistan, in Sri Lanka. The needs are emerging. We're now starting to see in Southeast Asia, the COVID levels are increasing. So there needs to be an ability to solve for India, but also for the region and beyond. And the Global Task Force has firmly understood that we need to work with governments to think about this as a global problem. We came through a very difficult year here in the United States in 2020 and are just emerging into a better place. And yet, if this pandemic surges around the world, we ourselves will also be impacted. So we need to solve this for the world, and we need to act in a coordinated and unified manner. And that's what I think it's going to take.
Thank you, Nisha. So if we can have all the panelists come back on with their video, that would be great. And we have a few minutes for questions before we hear from the Surgeon General himself. I wanted to dive into vaccines, both communication around them as well as the efficacy. I believe it was mentioned I'm the I'm the CEO and founder of URL Media, but I also run Epicenter NYC, and our company has helped vaccinate helped booked people for more than 5,000 vaccines in the US. And we've really, in recent weeks, been seeing a desperation from family members visiting from overseas to get their vaccines in the US. And similar to Nisha, started to hear this from South Asia earlier than we kind of caught up to what was happening in India. I wondered a few questions that have risen in the chat over Bharat Biotech, the vaccine. Dr. Muqdad, I don't know if you have any information on that, or Dr. Kang on its efficacy against the variant. That's one question. The second is just which I'll come to Nisha on second, but I would love to hear from all of you, is just in getting vaccines to India and what the state of that is looking like right now. Dr. Muqdad, can we start with you?
Thank you. Yes, and the table I showed, vaccines that we have here in the United States, Moderna and Pfizer, do have a better efficacy, effectiveness against the virus and against the new mutation for sure. But I need to be very careful here. And any vaccine that is available to you, as soon as possible, you take it, because it will prevent serious illnesses. So it's very important for all of us to take the vaccine. And yes, we do have in the US better vaccine. And yes, we should start looking into giving the vaccines to other countries, because we have more than what we need right now, quite honestly.
Thank you, Dr. Kang. Any thoughts on, and Bharat Biotech has come up a bit in the chat as well.
Oh, I've seen the comments. So one, I'd like to look to the data in the UK, where the Pfizer and the AstraZeneca vaccines have been performing equivalently. So making the argument that the US has better vaccines, I think is something that still needs to play out. I understand that the vaccine trials showed a higher degree of efficacy. Now, where AstraZeneca and the Bharat Biotech vaccines are concerned against the variants, there have been studies that have been done in the laboratory, and those have been done mostly in India, but in more than one lab. One of the studies showed that the vaccine, the Covaxin, had good neutralization against B1617 and against B117 and B1351. There is a reduction, but it's an about 50% reduction in neutralization. There is another study that has looked at B1617 at Emory, and that study has shown that for people who have received the Pfizer vaccine and people who are convalescent sera, the reduction in neutralization is 7 times. So I think these lab data are useful, but ultimately we are going to understand about the performance of vaccines when we do vaccine effectiveness studies. In India, there's already evidence that, well, 90% of the vaccine that has been used in India so far is the AstraZeneca equivalent Covishield vaccine. About 10% is Covaxin, the Bharat Biotech vaccine, and there are early data from Mumbai looking at the over 60s, indicating that there is a reduction in disease. So these are very early data. Now, to the question that was in the chat, which asks specifically about my stand on Covaxin in January, I'd just like to say that, I've been working on vaccines for 20 years now, and I've always been an advocate for high quality, safe, and effective vaccines for India and for Indians. I maintain that stand. I maintain that data are important. And if in the US you were asked to license a vaccine that had safety and immunogenicity data on less than 1,000 subjects, I'm sure it would be very unlikely. So I don't see why India should be held to a lower standard.
Thank you. That's very helpful. Nisha, before we turn it over, do you want to just jump in on vaccines from a global export-import perspective, how are we doing on getting them to India?
Well, I think it's a question of how do you ramp up production to meet demand? And clearly, as more and more vaccines come online, which there are a number of additional vaccines that are under development and that are in phase 3 trials, et cetera, the production capacity around these will generate. I think that the projections are that by the end of 2021, we're on track to potentially have, up to 12 billion doses of vaccines in the global supply. But getting to that point is going to be challenging. And right now, as we're seeing an urgent need in India and beyond, we're in a race against time. The standing up of new production capacity is challenging, right? It's challenging because you need to source all of the raw materials that go into those vaccines. You need to build the manufacturing capacity with all of the technological, equipment that you need. And you need to create the supply chain distribution mechanism. The vaccines that are already in production in the United States, in the UK, the Russian vaccine, the Chinese vaccine, as well as India's own production capacity, are going to be the ones that are going to most immediately be able to surge in to meet needs. And then new vaccines and new capacity will scale up over the coming months. And so I think it's that the immediate problem will not necessarily be solved by vaccines in the most urgent kind of next several weeks. It's going to require those, those interventions that Dr. Muqdad spoke about in the beginning, which is one, stop the spread, flatten the curve through social distancing measures, lockdowns, masks, et cetera. And two, it's going to require the treatment and diagnostics to be scaled up. And that's where the focus has been from the business community in the short term, is meeting the urgent medical supply needs. And then the third piece of it, of course, is to flow in the vaccines as quickly as possible based on where supplies are and how we can surge those forward.
Thank you so much. So we will pick up many of these threads in a Q&A in about 20 minutes or so, but I'm going to turn it over to Parag Mehta. He's the senior vice president at MasterCard, where he leads efforts to advance sustainable and equitable economic growth around the world as executive director of the company's Center for Inclusive Growth. He has spent the past 20 years working to advance justice, inclusion, and human rights through political activism, public service, and new philanthropy. And that is also why he has been my friend for much of those past 20 years. So Parag, I'm turning it over to you. Thank you.
Thank you, Mitra, and thanks for that great conversation. I want to now invite my former boss, the United States Surgeon General, Dr. Vivek Murthy, to come and join this conversation. We've all seen Dr. Murthy's tireless work in communicating important public health information throughout this crisis. And Dr. Murthy, it's always a pleasure to see you. First of all, how are you doing? How's your family? And how are your people in India?
Well, thanks so much, Parag. It's so nice to see you as well. Good to see you again. And I actually particularly like the pictures you have above you. When Parag was my chief of staff, he was kind enough to give me a picture of Gandhi looking into a microscope he and Vaibhav, and I still have that with me until today. But thanks for asking about our family as well. I think this has been a hard time for our family and many others in the diaspora community who have family in India. We've lost a number of relatives in India over the last several months. We have a number of relatives who have been hospitalized. Most recently, my father's sister and her husband were in the hospital. Thankfully, they made it and they have now been discharged. But it's a difficult time just wondering when the next phone call to India is going to bring news of another relative who's very ill or sadly has passed away. And I know so many of us on this call are in that position right now. So, but with all of that said, I count ourselves fortunate and blessed to be healthy ourselves in terms of myself, my wife, my parents, my sister. We are blessed to live in a country where a vaccine has been available and where we've been able to get vaccinated. and protected. And we want that obviously for India and for the whole world. But thankfully we are doing okay. Thanks for asking.
I'm glad to hear it. I want to jump in with a question about something that happened this week. The CDC released new guidance that said we can, those of us who are vaccinated don't always have to wear a mask when we're out in public. I'll be honest, Dr. Murthy, I was in Greenwich Village the other day. It was crowded. The restaurants and the bars were packed. And I have to say I had a moment of anxiety without wearing my mask. What are you doing? Are you and your wife who are vaccinated, are you wearing masks out in public?
So it's a great question, Parag, and I'm glad you asked because, as we navigate our way through different stages of this pandemic, as it worsens and gets better, these are going to be difficult decisions for us to maneuver. We've been used to wearing masks in our house for more than a year, right? And the notion of giving them up is, it takes some getting used to. But I'll tell you how we're thinking about it. So there are a few settings where let me run through one outdoors, right? So when we're outdoors, we generally feel pretty good about not wearing masks because the incidence of transmission in outdoor environments is actually really, really low because the ventilation is good outdoors. The other circumstance where we actually feel comfortable going in without masks is when we are indoors with other people who are fully vaccinated. So over Mother's Day, for example, we got together with some close family and they had all been fully vaccinated, which means that they were 2 weeks after their last vaccine dose, whether that was your single dose of Johnson & Johnson or in this country, your 2 doses of Pfizer and Moderna. And, we felt comfortable being without masks, again, consistent with CDC guidance. But there are some other circumstances where just us personally, we may behave differently in terms of masks and still keep them on. So we are, first of all, living in a county which has a very high transmission of virus, right? And that's not true all around the country. Some counties are doing really well, others are still struggling. The other factor for us is we have young children, 2 kids, in fact, who are not vaccinated because there's no vaccine available for kids their age. And so we're also mindful about protecting them. And also just knowing that we're in a world where we can't always verify the vaccine status of people in a grocery store, for example, or elsewhere. And when people aren't wearing their masks, you just don't always know, is that because they're fully vaccinated or because they just don't want to wear one and they're unvaccinated. So in circumstances where, especially where we have our kids with us, but when we are in sort of crowded places like a grocery store, we'll probably still wear our mask. And finally, just keep in mind, there are a lot of businesses trying to make decisions about this too, who are trying to digest the guidance that came out of the CDC recently. And you should know also the CDC, based on my conversations with them, they're planning to hopefully put out a lot more guidance that is specific to schools, to workplaces, to hopefully retail establishments as well, that will help guide that. But, there are a lot of stores, my guess is that will likely keep masking requirements in place. And so bottom line is do what you are comfortable with. If there are risks that you're concerned about, there is no shame in continuing to wear masks, just like my family and I will continue to wear masks in certain circumstances as I shared.
Yeah, that's helpful. And I'm glad to hear that there's more coming from the CDC for business owners. I want to dive right into our topic. As you heard in the previous session, we heard Dr. Kang give us an assessment of what's happening on the ground in India. Dr. Muqdad painted a picture with the data about the progression of the epidemic there. And of course, Nisha talked to us about the business and philanthropic response. I want to turn to you on the question of the public health response. And there are a lot of questions in the chat for you. The Dia Foundation organized this call specifically to respond to a wave of misinformation and disinformation that's been spreading about this pandemic. I see it on my family WhatsApp chats. I have to sometimes scold family members, don't just forward anything that you get. But we've also gotten a lot of messages since we started promoting this event asking, why are we focusing on this topic? Given the fact that people are suffering, people are dying, shouldn't we just focus attention on the virus? And on a more granular level, the question that my husband Vaibhav asked me is, why do you have to respond to everybody? Like, it's okay, let people believe whatever crazy things, keep on scrolling. So as someone who champions public health and public health information, why is it important and necessary even for us to respond to falsehoods?
Well, Parag, because misinformation is a virus itself. And it harms people, and it sometimes compels them to take actions that are put them and other people at risk. An example would be misinformation about masks, which has led many people to not wear masks, and has led them in some cases to get sick or to transmit the virus to other people. But misinformation also we should be I think, mindful of how it spreads, and because that informs, I think, how we respond to other people. Most of the misinformation out there that is spread and received is being spread and received by people with good intentions, right? So they, like, I think my parents, like many other, Indian immigrants of their generation, are a part of WhatsApp groups, and they serve a wonderful purpose of keeping them connected to friends and family. But they can also become platforms through which misinformation rapidly spreads, and that has been the case, as well. And so the reason it's so important to address is again, because if we do not, in a pandemic, when you're responding, information is power. And if you can't get the right information to people, they can't take steps to protect themselves. And it's not just about, again, what government can do. Government can make and work with the private sector to produce all the vaccine in the world. But if people are not willing to take it because of misinformation that's been disseminated, then that vaccine is not useful. We can make all the masks in the world. If people are not willing to wear them because they've heard incorrect information, then that is, again, is highly problematic. The last thing I'll say of this is each of us has a role we can play in addressing misinformation. You don't need to have a medical degree or a nursing degree. You don't have to be a gifted communicator like Parag. You don't have to, have all of those tools which you might think are necessary to combat misinformation. Because at the end of the day, people listen to the people they trust. And that often includes family members, right? But we just have to remember that number one, when we get information from other people, number one, remind yourself that the source matters, right? And the source is not your uncle or aunt or sister or brother who sent it to you on WhatsApp. The source is a person who created that content, who made that video, put out that post, right? And again, they may have the best of intentions, but there's a lot of misinformation that's out there. So the question is, did it come from a reputable source? Did it come from scientists? Did it come from government agencies that are grounded in science, like the CDC being one example, but not the only example? But the second thing just to ask yourself is, before you post anything, is to be triply sure that it is a reliable source. And if you are unsure, do not post. Because you might think it's a benign thing, you're just trying to help people, but posting misinformation can be deadly. And we've certainly seen that in the past as well. And finally, just keep this in mind as well, that when you see misinformation out there as well, and you recognize, hey, there's something out there that my friends and family are pushing that is not true, it's actually very helpful and important for each of us to stand up and to note that. We can do so kindly. We can do so without impugning the intentions of other people, recognizing most people who are pushing this out, they want to help others. That's their intention. But we need to flag it nevertheless, because otherwise we will we'll be in a scenario where this continues to propagate, and then real people will get hurt. Beyond us, though, Parag, I think it's just important for us to note that much of this misinformation is being spread on media platforms, right? On WhatsApp, on Facebook, in other social media platforms as well. And to me, as an American citizen, as a user of platforms, just as part of the global community, I think it's absolutely essential that we hold platforms accountable for the information that they allow to disseminate, especially misinformation. Look, I'm a doctor by training. If I was running a hospital, let's say, and I was doing knee surgeries and treating pneumonias, but I had a really high rate of line-associated infections and other complications that were happening in the hospital, it would not be okay for me to say, well, don't pay attention to the side effects and the bad things that are happening in the hospital and the infections that we're allowing to brew. Pay attention to the good things that we're doing. We fixed somebody's knee. We treated somebody's pneumonia. You would say that's terrible. You have to both be effective in your delivery of care and safe in how you deliver it. We should have similar standards that we apply when it comes to our media platforms as well. They should be responsible for putting robust mechanisms in place to not only push out accurate information, but also to remove misinformation, especially disinformation. And if you're wondering what the difference is, disinformation, unlike misinformation, is intentionally, willfully spread. And we see that pushed out by certain people who have malicious intent, in some cases by actors, outside the country who seek to harm, folks inside the country. But it's important for these platforms to take a much more proactive, responsible stance, and they need to be held more accountable for doing that.
Yeah, and I appreciate that it's actually something that we can all do. There are a lot of people who are saying in the chat, I'm a physician or I'm somebody with medical training. Can I go to India? Can I help? Can I do telemedicine? And this is something important that every one of us can do, is to correct things that are incorrect on the record. I want to move to the question that came up.
Can I just share one last thing? Just on that point about doing something, like if you're worried about your relatives in India, it's not a bad idea to call them and ask them what they're doing to be safe. And the answer may surprise you. I'll give you just an example from our situation. We called, one of our aunts who had gotten sick, and we talked to her and make sure she was okay. And so then I asked my dad, I said, she's supposed to be, we know the whole family is aware that COVID is spreading, and they said they're taking precautions. Let's just ask her what they're doing. And it turned out they said that they were not seeing anyone. But when they said we're not seeing anyone, they meant we're not seeing anyone except for our daughter and her children who live in another household, for close friends who may come over. And we know, some of us may know that even though those are people we may know and trust, because they're outside our household, they may bring the virus in. And that's likely how my aunt got sick. So a simple thing you can do is ask your family and friends, are they wearing a mask in India? Are they actually keeping distance from others when if they do have to go out? Are they avoiding gathering with people outside their household, either in their house or in other people's houses? That's a very simple but concrete way through which you can make a difference, as well as by encouraging them to get vaccinated when vaccine becomes available to them.
Yeah, that's the key with basic questions, right? Is ask the follow-up afterwards. Make sure you're clear on who other people are. I want to go to a question that, exactly. I want to go to a question that Mitra was asking of Nisha. A lot of concern in the community about the US response to what's happening in India. Was it too slow? Did the US not do enough? You're obviously inside the Biden administration. You're in these conversations. We've got you, we've got Vice President Harris, two very powerful Indian American voices there. What is the US doing to support India through this?
It's a good question, Parag. And I think we should talk about what's happening now and what needs to happen in the future, right? So there are a number of steps the US has taken more broadly with India that, the Quad agreement that we've heard about, has been part of a larger partnership that the US and India have been building that include a partnership around health and around pandemic response. The immediate response a few weeks ago to send materials and supplies to India, from masks to therapeutics to diagnostic testing kits to some of the tools that are needed, specifically filters for vaccine production that will enable the production of millions of doses. These are some of the things that the US pushed over, in addition, of course, to providing technical assistance from USAID and to CDC for laboratory support. Because keep in mind, a really important part of what has to happen here that doesn't make the headlines is actually strong testing. So we know just how much infection there is, what kind of infection, what strain, if you will, or variant is there, so we can target our research and our interventions appropriately. This is all part of what has happened. And I need to really just tip my hat also to the diaspora community here in the United States, which responded powerfully and in such a wonderful way in sending supplies over, getting materials over. So many people have stood up to help. And I'll say, just as an Indian American, that gave me a real source of pride, in our community and our ongoing willingness to stand up and do more for the country back home. But I want to say going forward is going to be really important, because as helpful as these measures may have been, there's so much more that India needs, right? So let's go through that. Number one, India needs vaccines, right? And so the US announced that as soon as its AstraZeneca doses are cleared by the FDA, that it will push those out to the global community. Now, somebody asked in the Q&A, how soon will that be, right? And while I don't have a specific timeline, I will tell you that it'll probably be on the order of weeks that we're looking at for the FDA clearance, not months, more like weeks. But that is the vaccine that they have available now, about 10 million doses of AstraZeneca. There's another 50 million AstraZeneca doses that will become available in May and June if the production timetables go. And as soon as that is also cleared, then that can be pushed out to the global community. But there has to be more done than that, because the truth is that the vaccination needs for India are much more profound. And what we have to do is not only provide doses to India, but think about how to increase manufacturing capacity, not just for India, but for the world. And that is actually several-fold. Like many people read in the papers a few weeks ago about the TRIPS waiver, which was specifically the United States announcing that it would support waiving intellectual property protections for the vaccines as part of increasing, or reducing barriers to broader production. while that may be helpful, there are other steps that have to take place as well. There's a transfer of knowledge, the tech transfer, if you will, of you may have a recipe, but how do you put that recipe together? That matters, and that has to now be something that we push for. There has to be the manufacturing capacity set up as well, which Nisha referenced, which is so critical in this as well. But look, this is a place where there is a market failure, right? If you take an individual company and you say, build a scale up production to be able to supply the world with vaccine, they may do that for this pandemic, but then what is that facility doing for the next several years post-pandemic? And so that may make manufacturers pause. That this is a classic place where I do think government needs to step in and work with the private sector. And then the raw materials is also key. If you don't have the raw materials, all the factories in the world won't help you. So we've got to work on the supply chain there as well. So these are all steps where you will more has to be done in the global community. You will hear more from the United States about plans to increase, even further activity on these areas, recognizing that not only is the situation in India important, but one of the ways you help India, and that we all need to help India, is actually by reducing the spread of virus outside India. Because in the same way that we've said that the spread of virus anywhere is a threat to any nation, because variants can develop that can actually over time evade the vaccine. The same is true with India as well, and even if we get it under control, if other countries like Brazil and Uruguay and others are flaring in their infection and more variants are developing, that will ultimately put India at risk once again.
Yeah, and Dr. Murthy, you talked about vaccine access, but we also know that you have to focus on vaccine usage. And there has been an issue of hesitancy. I saw President Biden shared a video that you did on Friday talking about vaccine hesitancy and how to talk to people who are unsure about whether to take it. I assume that this would not be a problem in India. After all of the devastation of the last 2 months, I assume that anybody in India who could access the vaccine would get it. But yet what we're hearing from people on the ground is there are concerns about the vaccine. There is hesitancy there. And I just wonder, so what lessons have we learned in the US that could be applicable to India as they try and build public campaigns around getting people to take the vaccine?
That's such a good question, Parag. And this is a place where there actually are some significant parallels between the US and India. Look, no countries have been hit worse than the US and India by COVID-19. Yet the amount of misinformation on COVID that has spread to the population, the number of people who are saying perhaps they don't want to take the vaccine, I think it surprises people, outside these two countries. But look, even here in the United States, right, we have a significant portion of people who are reacting to misinformation and are trying to figure out what's true and what's not. So I think a couple lessons we've learned here is number one, you can't communicate enough about the facts around the vaccine, specifically around how effective they are and how safe they are. Just because you think the studies have been done and you held a press conference and put the information out there, it does not at all mean that it's gone through to people. The second thing I think we've learned is along those lines is that you have to use as many channels to reach people as possible. Not everyone is reading the main paper, the Times of India, or reading Indian Express. Like people are maybe reading their local paper. They may not be reading any papers at all. They might be listening to All India Radio, to Doordarshan, or their local station. Who knows where they are? But that means that we have to use multiple channels to get to people. And then the third key lesson is the messenger matters, right? People, especially at a time of fear and worry, people look for voices they trust. They may not all trust, their elected leaders or the newspaper. But what we found here in the United States is something, around 80% to 90% of people were saying that they actually wanted to hear from their doctor when it came to making a decision on getting the vaccine. Recognizing that many people in India may not have a doctor, just like many people in the United States, in a healthcare system that is still trying to strengthen and get better and provide everyone with primary care. I know that may only help a portion of the population, but I think it's incredibly important for doctors and nurses and other health professionals to reach out to the people they care for and talk to them as much as they can about the vaccine and about getting it. But family and friends are also those trusted voices. In the US, we found, for example, about 50% of people in surveys say that they would turn to a family or friend, for advice on whether or not to get the vaccine. And so what that means is that if you're out there and you've made the decision to get the vaccine, don't stop there, but reach out to your family and friends. Ask them, do they have a plan to get vaccinated? If they have questions, help them get answers to those questions. If they have difficulty making an appointment, then help them think about how to go about doing that. But never underestimate, as a family member and as a friend, just what a profound impact you can have on eradicating misinformation about vaccines, on encouraging people to get there and get vaccinated. And finally, just keep this in mind. With all of the focus, Parag, even in the US, on vaccine hesitancy, as we call it, It turns out when you look at people who are not vaccinated yet, there are actually 3 primary reasons why they're not vaccinated, and hesitancy is only one of them. So some people do, in fact, have questions, right? And they want to get those questions answered. Is it safe? Is it effective? Is it? But there are also another group of people for whom motivation is the issue. Maybe they're young and healthy and feel they're at low risk and don't need the vaccine. Or maybe somebody has told them that this whole COVID thing is a hoax and it's not a big deal and it's no more dangerous than the flu. By the way, all of that is not true. But in that case, they may have a motivation sort of challenge, and they may be perfectly fine with vaccines, but they just may not think they need them. And that's where we need to help emphasize to them that all of us getting vaccinated is how we break the chain of transmission and how we prevent the spread of COVID. But the final group is not getting vaccinated because of access issues. We see that time and time and time again in the United States, despite all of the channels that are available to get vaccines. What we've seen is that for some people, they're not getting vaccinated because they're worried about taking time off from work, or they're worried that if they don't feel good, after their second shot and they may have to miss a day of work, will their pay get docked, or will they get fired? Other people aren't quite sure how to go about making an appointment. And in India, my guess is that there are probably very similar concerns around access, and access issues, especially given the supply concerns, is probably much, much greater. And so we should just, as we think about how to get the country vaccinated, recognize that we've got to improve access. We've got to help people recognize why it's important to get vaccinated. That's a motivation part. We've got to root out misinformation. And if we do those 3 things, then we can put ourselves on the path to vaccinating the community and to ultimately preventing the spread of COVID.
Yeah, and I appreciate your point about trusted messengers. It's the reason why we like talking to you, because you're America's doctor, but sometimes you like to moonlight as India's doctor. And I know we appreciate the insights. I want to close with a question beyond physical health. And I want to talk about the enormous mental and emotional toll that this pandemic has had on India and on the world. They say that, as with Partition in 1947, there is likely to be generational trauma caused by COVID-19. You and President Biden have had a lot to say about grief and about emotional well-being. I'd love to get your advice on how we can best safeguard our own mental health and the mental health of the people we care about as we come out of this pandemic.
Parag, what an important topic to raise. And I'm not surprised you raised it, because you've also been an important champion of talking about mental health, of pulling down so many of the barriers that prevent us from treating it like an important part of our health, which it is. With COVID in particular, I'm deeply worried about the impact it's going to have on our mental health. It's already had a profound impact. In the United States, we've seen anxiety and depression rates soar during this past year, and it's affected kids as well. So this is affecting all parts of the population. But sometimes and many times when we look at natural disasters as a parallel, we see the effects go well beyond the disaster itself. So even after the pandemic subsides, my worry is that for many people, their mental health may worsen. In fact, many people have been holding it together during this difficult time and just trying to do everything they can to get through this. But there will be an aftermath to it as well. The word you use is actually very appropriate, which is trauma. Right? This is a form of trauma that we've experienced. And unlike a hurricane, which I've lived through, or tornado, or other instances which come for a short period of time and subside, this has been a prolonged form of trauma that has impacted so many dimensions of our life. I think the first thing we have to do is recognize that this is trauma that will have an impact on our mental health, such that if we are experiencing anxiety, depression, worry, that we don't think we're somehow weak or broken in some way, but we recognize we are going through a natural response to a very, very difficult situation. I think the second thing that we can do is we can recognize that this is affecting other people as well, and that one of the most powerful antidotes to that suffering that so many of us feel on a mental level is actually the kindness and compassion of others. And that comes by people who are willing to check in on you, to listen without judgment, to lend a helping hand when you may be having a difficult time. Keep in mind, none of these things require medical training or expertise. The truth is that all of us, regardless of our age or our educational background, we have the ability to help others heal. We are healers in our own right. We have an intrinsic ability to do so. This is one of those moments when we need to tap in to that ability to heal. And again, the ways we do so are disarmingly simple, but extraordinarily powerful. It is our presence, our willingness to listen without judgment. It's our willingness to reach out and help people, whether those are members of our family, a friend who might be having a tough time, or a stranger who seems like they're struggling in the grocery store. These are the moments that make people feel better in the moment, but also remind them that they are not alone. And one of the great challenges of this pandemic is it makes us feel like we're alone. right? It makes us feel like we are alone in our struggles, that there may not be someone there to help us as we come through this. India, like many countries, has struggled, I think, with mental health and with the stigma around mental health. Growing up, I remember so distinctly, we had a family member who struggled with depression and ultimately, took his own life when I was in high school. But there were other members of the family who said, we can't talk about this because then nobody will want to marry into our family, right? And that's not a unique story, right? So many of us have experienced that. Parag, I know in your family, you've also had to, experience and witness some of these, examples of stigma. But stigma changes when we lead by example, when we speak up and share our stories, when we have the courage to stand up for somebody who may be treated poorly, and to say, they don't deserve that. They're not broken because they're struggling, but they're going through a human experience that all of us are susceptible to. And so I think we have to keep this in mind as we get through this pandemic. And my hope for India is that this will also be a moment in India where people will think even more deeply about mental health, how it's talked about in India, how the healthcare system seeks to both identify those who are struggling and extend treatment to them, but how we really think about an all of society response to our mental health. Because mental health isn't just about, do you have access to a therapist, right? That's an important piece of it. But mental health is also about what kind of workplaces do we create, and do they support our well-being or not? What do we provide children with in terms of a foundation for social and emotional learning that gives them a foundation for mental health and well-being throughout their life and helps them build healthy relationships? Mental health starts in our families, where kids from the earliest of ages look at how we as parents live our life, how we conduct ourselves in our relationships, and they take their cues from that. And so mental health is a really all of society, sort of phenomenon. It's a need that requires engagement of all of us. And this has got to be, I think, an important part of how we think about the pandemic and post-pandemic response.
Well, thank you. As always, I leave our conversations feeling better and feeling more informed. I want to thank you, Dr. Murthy, for giving your time to us during what I know is a really busy period for you and all of our public health leaders. If you're able to stick with us for a few more minutes, I know we have a lot of questions that have come in from the audience, and I'm sure they'd love to hear from you. But I'm going to turn it back to my friend Mitra to facilitate the next portion. And Mitra, if I can turn the tables on you and make you from moderator to panelist, I do want to ask you one of the questions that has come up a lot. There's been a lot of angst on social media and WhatsApp about the media coverage of COVID-19 and the crisis in India. My parents are both on this call. They've expressed this frustration to me. Namely, they're telling me that the way that the Chinese and the Western media have portrayed the situation, stories of gross incompetence, stories of doctors abandoning their posts, the dehumanizing narratives about dead bodies in the streets or floating in the river. And of course, there's the money shots of funeral pyres every media publication keeps putting up. Where are the stories of heroic health practitioners and volunteers who are mobilizing to help? Why are we not getting the kinds of sympathetic profiles that victims in the US and Italy saw during their outbreaks? I'm also substantially worried about the anti-Asian hate that plagued East Asian communities could become a narrative that hurts our community as we start hearing stories about a new Indian plague. And so I want to get your take as a journalist, as a media company owner, somebody who's very involved in the journalist communities and tells stories about Black and Brown communities. Are these concerns about biased coverage, are they warranted? And what are you telling your peers about responsibly reporting on this crisis in India? What are folks listening today, what can they do to help?
Sure, it's an excellent question. Hello to Mr. and Mrs. Mehta, I should say auntie and uncle, for joining us. I think the questions are very valid. I would look at it from another perspective, which is death itself and the way that it goes down in America and India is very different. And in so many ways, what we're seeing in India is public mourning in a way that families are not able to mourn. What I've been struck by, having been through many death rites with my own family, is the absence of all of us gathered around the body and the wailing, and it's a very cathartic, probably one of the most beautiful experiences I've ever been through in my life. And the absence of being able to do that right now has been very stark to me as I kind of see people mourning alone. So I think some of it is just that Indians and their hospitals, their sort of the collapse of the health system, as well as cremation, the process of how death is conducted is different from the US, and the coverage is reflecting that. That's not a defense of what is very rightful, which is to say, would we ever show that of Americans? And you know, I was at CNN when the pandemic began. I have to say, in hindsight, I question how we covered the pandemic, not just at CNN, but in the country writ large. I feel like because journalists were able to largely do their jobs from their living rooms, we covered the pandemic as though everybody was able to do their jobs from their living rooms. And so what I think we see happening in India is honest, it's raw. Would we see that in the US, and is the allegation of racism warranted? Absolutely. Am I glad that there's a media lens, literally lenses on India right now that forced much of what Dr. Murthy just talked about in terms of the patent and tech transfer? Absolutely. Do I feel like people are paying attention to this as a result of the media? Absolutely. And do I hope that we continue to cover Nepal, Bangladesh, some of the other, Peru, Brazil, some of the other countries that have been mentioned? Yes, very much so as well. And then your question on racism, I actually was going to ask the panel about that as well. So I'll segue from that to get some other thoughts on this. But one thing I would advise for people to look at is the South Asian Journalists Association put out guidance around the term Indian variants. I am guilty of using it in the early days as well. I've now, you know, either said variants discovered in India, or the, I think it's B1617, which is a number I've kind of committed to memory because that is the variant. Just to be more specific in what we're talking about, as opposed to blaming and damning a people for a virus that is going to mutate. And I think just language really matters. And I do think that's a fair question, because maybe this is, Parag, where you and I hand off, but I was going to ask Dr. Murthy if the Biden administration is talking about potential anti-South Asian violence as a result of the variant, or has that, I just wonder if that's a subject of concern.
Well, Mitra, first of all, it's so good to see you.
It's so good to see you
after a long time. And I think it's a really good point you're bringing up. You know, we've had, you know, variants that have been identified first in various countries, but to, you know, to tag the name of that country with the variant, I think does create an association that somehow it was that country's fault. So, you know, what we are always, like, in the folks in the inside the Biden administration are very careful to use the number of the variant when we talk about it. We talk about the 117 variant, the 135 variant, the 617 variant, which you just mentioned. And we are given everything that we have seen in terms of anti-Asian American violence, you know, during this pandemic, especially because of how it was characterized early on, you know, as the China virus, or as, you know, other sort of like Asian slurs associated with it. We've seen a lot of that violence, and it's been a big source of concern to us. So we are absolutely, you know, I would say, aware of the fact that the potential for that to surge, you know, when these kind of associations are made, is always there. So we've got to be mindful of it, but it also, to your point, words matter, right? How we communicate about this, how journalists in particular write about it, but how all of us who have public platforms speak about it really does make a big difference. And it's a difference between splitting us up in such that we blame each other for various variants versus pulling us together, recognizing that we are all at risk. There are variants that have been developed here in the United States as well, that are, or first identified here in the United States as well. But we don't call those like the American variant, you know, that's going out, you know, and causing problems in other countries, because we realize that until all the variants are, you know, until we identify them, until we address them, until we get vaccines to everyone, none of us will be ultimately safe from this virus.
Thank you. So shifting from the race and the variants issue, but staying on variants, I wondered if Dr. Gong, you might want to take this one. It's a question from Usha Ravi. What about the emergence and spread of COVID variants? How do we prepare and counter these variants before next waves are created? So India, of course, is in the middle of a variant. Is there concern of subsequent variants?
I think with the amount of virus replication that's happening in India at the moment, variants seem almost inevitable, because if you have replicating virus, it is going to mutate. And the chances of new variants developing that are variants of interest or variants of concern is only going to increase. So we really need to suppress replication. And the only way we can do it is with what we are doing now, which is coming into some level of lockdown, making sure we use non-pharmaceutical interventions and keeping the vaccination going. Unfortunately, over the last couple of weeks, vaccinations come down, so that's disappointing, but we just have to keep pushing at making sure that we suppress spread, suppress replication to prevent variants.
Thank you. Dr. Muqdad, do you have any thoughts on that?
I want to comment briefly on the naming and saying we still say the Spanish flu in 1918, which is not fair. But I need to remind everybody that we here in the United States had our own homegrown variants in New York and in California. And the B1617, one of its mutation is the one from California. So we're all interconnected here and we need to help each other. And yes, we should call the variant first discovered in that country. And we need to stop that blame and racism here, and addressing it is very important.
Thank you. So Nisha and Dr. Murthy, I wonder if on the variance issue, we really have been having this undercurrent of the concern. Well, it's a great thing we're all one world, we're connected, but of course that also leads to the spread. And so I just wondered a few questions in the chat, Dr. Murthy, around mask, the mask guidance this week from the CDC. Was it too early as we might be dealing with other variants? Is that something people should be worrying about? And then we'll come back to Nisha on kind of following up on variants and global business and the global economy. But why don't we start with you, Dr. Murthy?
Sure, thanks, Mitra. So, I'll tell you that the reason the CDC made the decision they made was in part informed by data that told them that the vaccines that we have available in the United States right now are in fact effective against the variants that are circulating in the United States. To your broader point though, and to the person who asked the question, could this change down the line? Absolutely yes, right? Because we know, as Dr. Kang, I think, articulately said, that as long as the virus continues to replicate and we have a profound, uncontrolled spread of the virus in other parts of the world, there will be new variants that develop. Now, the vast majority of those variants will be clinically inconsequential in the sense that they may not make the virus more likely to spread, or they may not make for a virus that evades the vaccine's protection. But every now and then, one of those may arise. And that's one of the reasons why, even though the CDC felt confident that now it was okay for them to issue this guidance, they were also mindful to say that if the circumstance changes, that our guidance may need to change as well. And that's, again, also why it's so important for us to be a global partner here in ensuring that all countries have access to adequate vaccine, and that we have surveillance systems ultimately in place across the world that can detect virus and when it continues to flare, as it is right now in many countries. And that's something obviously we need to get a handle on.
Thank you. Nisha, I wondered if you want to weigh in on that, because different countries have different vaccines, but companies largely see, hopefully, their people as one workforce. So how are they contending with different vaccines, different variants, and then, quite frankly, different travel, mask, and other policies? That might be, I'd love to hear your perspective on that.
Sure. And before I answer that, let me just note that in terms of kind of the stories of heroism in India, there are so many stories of how Indian healthcare workers, Indian businesses that have mobilized to produce all of the equipment that's needed, that have transformed their factories to meet the need that the country is experiencing. Indian NGO workers and Indian government officials at the state, local, and national are working 24/7. I think Dr. Kang is an embodiment of the spirit across India to try to mobilize, to solve the challenges, to address the needs. And it's really important for the media to go beyond kind of, gawking at what's not working and actually reporting on what is being done to help meet the need. Is a really important narrative to get out there. And so I wanted to just underscore what Parag was saying. But in terms of how is the business community dealing with all of the complexity, and it is a very complex situation as you look at the needs, not just in India, but that are emerging in so many countries. And how do you help protect the workforce. In India, in Brazil, in Mexico, in Bangladesh, what have you. And it's a very complicated scenario that is an interplay of what's locally available, what information is available, and how do you help companies make decisions. What we've created in response to that is a CHRO working group. This is the Chief Human Resources Officer in each company. And we've got hundreds of companies now who are participating to share information, to understand what is locally available, what are the changing conditions, what are the workforce needs, how can you support your workers, what vaccine policy is going to guide the prioritization and distribution of vaccines. How can you keep people out of hospitals by giving them access and support for health at home, home health kits, virtual visits, apps that can help them manage their symptoms. So the business community is mobilizing to try to address these from a workforce perspective, and hopefully in so doing to also be able to help the community at large.
Thank you. And if you can't tell, I'm cramming a lot of questions into one just to keep us moving along here. We have 2 minutes left. What I want to ask each of you is something, we have dozens of questions, but something that continuously comes up is, what can I do? And this is framed in different ways. How is the US government helping? What can individuals, businesses, and nonprofits do to support India? Where are each of you individually giving? And so what I want to do with, let's say 30 seconds from each of you is just ask you to answer that question. And then if you have any parting thoughts, and then we're unfortunately going to have to wrap up. But the good news for the audience is that the conversation will continue. Dr. Kong, can we start with you?
So this is a difficult time really to help, and a lot of people have encountered challenges. So I think the best you can do is continue to put pressure on your government and make sure that vaccines and the aid that is already being provided can continue to be provided for as long as we need it.
Thank you. Ali?
Continue support to India right now. And as Dr. Murthy said, talk to your family and make sure they're doing the right thing in terms of prevention. And please assist as much as we can. Each one of us can do a big part right now to contain this virus at home and everywhere else, wherever we come from.
Nisha Biswal.
Thank you. So for individuals who want to help, it's important that you find organizations that will provide the kind of assistance you want to provide. Chamberfoundation.org has some organizations listed on our website that are working on India. You can also look at Charity Navigator. You can look at Gates Foundation and many other organizations that are working with local partners on the ground. Couple of things I would just quickly note. Oftentimes in times of crisis, people want to give things, right? They understand and see a need and they want to mobilize and send clothing or send blankets or send, oftentimes those kinds of in-kind donations at an individual level are really hard to actually move and to use effectively. So individually, what you can do better than anything else is give cash to organizations that you find to be trusted and in keeping with the mission that you want to support, whether it's local organizations working in communities that you have connections to, or large organizations. They need the cash to then operationalize it. Médecins Sans Frontières can move medical workers or care, or Indian organizations like SEVA who are working in rural communities. The second thing is you can be connected to the communities that you want to help and mobilize the diaspora community that is connected to a state or a town, and see how you can engage with them more meaningfully, whether it's resources or whether it's advice, it's personal, support. So you can connect through your community supports, and you can connect through your financial contributions.
Thank you. And before I wrap us up, Dr. Vivek Murthy, last word on this one?
Well, thanks, Mitra, and thanks to all of you at Dharma in Action, the Dia Foundation, for hosting this, and to Dr. Kang, Dr. Moqtad, and Ms. Biswal Nisha for amazing work the three of you do. I want to underscore what you said. I think talking to your family about what they're doing to stay safe, contributing to organizations that you trust is so critical right now. Also recognize that all of us can play a role in helping to stop the spread of misinformation and promote the spread of accurate information. And perhaps for many of us, the most powerful place you can do that is on your WhatsApp feed. So just be mindful of that, and how you participate in social media platforms. Because again, you could make the difference between somebody being misled on whether or not to get a vaccine versus them having the right information. And finally, just remember, all of this is extraordinarily stressful for everyone, right? If you're in India now, obviously it's stressful for the obvious reasons. The kind of grieving that Mitra spoke about early on, the public grieving that people are having to do, not being able to grieve properly for their family members the way they want to. This is an extraordinary level of human suffering at a scale that we've not seen in quite some time. But that suffering is also extending across the diaspora as people are unable to see family, as they lose relatives across. So we are, all of us in our own ways, struggling. And in this moment, this is when we need to step up and be there for one another, to support people, to reach out and check on them. These are small things that ultimately make a big difference. And all the policy in the world, all the resources in the world will not make all the difference it can if people are emotionally depleted and unable to continue in the face of this great suffering. Their replenishment, their strength, if you will, often comes from the people around them, and you can be a source of that strength. So I just want to remind people of that, because otherwise, in the face of tragedies of this scale, you can feel powerless, and you might think, well, what can I do as one person? Well, it is those phone calls and that outreach to family and friends and community members that can make all the difference in the world. In the end, we will get through this, but this is a global pandemic that requires a global solution, global partnership, global cooperation. The United States has got to and will continue to be a leader in doing that, believes really strongly in that. And as citizens, we should be asking our government, of nothing less, and pushing for that as well. But I think this is a place where, if we do this, can get this right by the end, as a global community, I hope is that we will be better prepared for the next pandemic, that we will be better able to work together to detect the next pathogen when it arises, the next virus, that we'll be better prepared to produce and develop, first of all, a vaccine, and then produce it at scale, so that the whole world can ultimately be protected. These are frankly lessons that we learned from Ebola and Zika, when I was actually Surgeon General during those times as well. But my hope is that we will be better this time around at actually implementing the lessons of this pandemic, so that we will all ultimately be safer as we move forward.
Thank you so much, Dr. Gagandeep Kang, Dr. Ali Moqtad, Nisha Biswal, Dr. Vivek Murthy. Thank you so much for being with us. This was just personally very cathartic for me right now. And I think the hundreds of people watching around the world would agree. You've given us some real concrete solutions, but more importantly, I think you've given us a lot of hope today. I am going to hand the program over to Shekhar to continue the discussion. Again, thank you so much. It was an honor to be with all of you.
Thank you, Mitra. That was a real fact check. And I would say, I should correct myself and say, on a Sunday afternoon. Let me thank our inspirational panel, and particularly Surgeon General Vivek Murthy. Vivek, what a pleasure to hear you. It is so important that the community hears from you and the United States hears from you. But it's our privilege to have you and to listen to your words. And I think we can help each other. We can support each other. You've reminded us that we have individual responsibility to be careful and to get everyone vaccinated. This is for something that all of us should do. And I also want to thank Vaibhav, Parag, Mitra, Toby, Jayaraman, Aparna, Maya, and the Dia board for making this possible. This is a completely volunteer effort, and we very much want you to be part of it as we go forward. Now to a few questions we've received for the Indian Embassy officers who are here. We are honored to have with us Anurag Kumar, the Minister for Community Affairs, and Naresh Kumar, the First Secretary for Visa. When we conclude this, you will see a link posted for a separate Zoom link where if you can join us in breakout rooms to talk about what we could do together individually and together as a community. So my first question is, and it may seem like a simple and basic one, but if somebody has to go to India for whatever reason, hopefully not a tragic reason, how does one get an emergency visa? Nareshji, do you want to take that one? We can't hear you yet. Sorry, we can't hear you yet.
Yes, please. Yes.
Oh, there you go.
Yes. Good afternoon to everyone. Briefly, I'll mention that last year in March when the pandemic started, all the visas, even the OCI card holders, the travel to India was suspended. But Government of India has gradually lifted all the bans. Now, most of the visas, I would say all the visas except tourist and medical visas, rest all the visa bans have been revoked. Unfortunately, majority of the people in this country have tourist visas and they go to the airport also without even checking, and then they are turned back. So the embassy and all our 5 consulates, the last 1 year, we have indeed been issuing visas on a regular basis. Our visas were never stopped. And depending on the location, details are available, how to obtain the visas. And, in the consulate or the embassy, I am going to post the link for the embassy, how to obtain a visa in these circumstances from the embassy. And I will also add my contact numbers as well as email ID. And similar information is also available on the websites of all our consulates.
Thank you, Nareshji. Anuragji, the question many Indian Americans ask is, there seem to be relief supplies going to India. Are they getting to where they are needed? How are they being distributed quickly and appropriately?
Good afternoon, Shekhar ji, and good afternoon to everybody. I wish to assure everybody that whatever supplies from the United States, and not only from the United States, but from across the world which are reaching India, are being sent, distributed, and utilized in the best possible manner, in the fastest way, and without wasting or letting them lag behind or letting them be stored at some place. But please be advised that there's a multiple kind of relief which is being sent to India. One, of course, is government to government, where like the United States government has sent in, administration has sent in 6 flights so far with relief materials to India, and another one is also due to be flown in shortly. Then there are business entities, corporates, those who are sending their relief material to India. There are individuals, and more importantly, in the United States is the community organization, the diaspora organizations, a huge number of community organizations who are doing a very wonderful job, a yeoman's job, and they are sending relief and materials to India. Now, the relief material which is sent to India, it is in terms of some priority items which have been flagged by the Government of India, which are basically oxygen-related equipments like generators, concentrators and cylinders, ventilators, BiPAP machines, and medicines like remdesivir and tocilizumab. These are the medicines. On these items, the Government of India has exempted the customs duty as also the goods and services tax. And the government has requested that these supplies be sent to the Indian Red Cross Society, which will receive it on behalf of the Ministry of Health and Family Welfare. From there, it will be distributed and sent. But simultaneously, many of the individuals, organizations are also sending it to the state governments, to the other entities and individuals in India, for which also a very simple procedure has been prescribed, wherein each state has appointed a nodal officer. And based on the 2 criteria, one, that it's a gift or donation item of these priority items, and second, it is being distributed free of cost for the COVID relief anywhere in India. The India end of the entity can approach that nodal officer, get a simple certificate from them that this is being used for COVID purpose for based on these 2 conditions, and they also get the customs waiver and the GST facilitation, whereafter they are supplying it to that. Now, so that, as I mentioned, that those which are being received by the Indian Red Cross Society, the Ministry of Health and Family Welfare is coordinating. Their officers are meeting round the clock. It has been supplied all across the country. Now, there are certain criteria which have been invoked by the government in supplying these things. I think they may be of interest to you. So one of the things is that the states which have a very high incidence of COVID. So the first focus is to ship the supplies there. Once they are received in India, they are sent to those states. Then there are regional medical hubs which are catering to small towns or villages which have seen a high incidence of COVID cases. So again, they have been prioritized and the relief is being sent to them. Places which have shown or which have flagged a high requirement of these equipments. So even if they don't fall in these two categories, it is being sent to them. I can narrate many of the medical institutions or hospitals where these have been sent, but I don't think that would be necessary. But that is how it is being sent. The entire effort is not to spread this kind of aid which is getting in India, to spread it out thin and ship it over long distances in a small quantities so that it gets delayed and it is not utilized. It doesn't get utilized for that. So this is how the government of India has been doing it. And at the same time, for the individuals or the states where it is doing, they are doing a similar job to ensure that these relief and supplies reach to the people who require it. Yeah.
Thank you. Thank you so much. My last question is really one that pertains to how people are trying to help. Many people want to help their hometown, their former hometown in India or their state, and they're trying to find organizations in those places. But given the recent, FCRA rules, it's not possible just to send a donation directly to that charity. What would you recommend when I feel I want to help my community, my hometown? How would I direct resources and money in particular?
Shekharji, there are two aspects to that. One is the relief material and other is the money that is being talked about. But before I get into that, I just want to mention that the amendments or the regulation in the Foreign Contribution Regulation Act, that is FCRA, had been affected last year. Based on the requirement, based on the considerations, it had been affected. Many of the non-governmental organizations which are functioning at both ends or abroad or in India, or those which are receiving the financial contribution in one way or the other, they have complied with and they are doing a job and there is no problem in that. It is our understanding that the equipment, the priority items that I have listed, if they are being sent anywhere, there is no issue, there's no problem related to FCRA or anything which is being done. Now here the key thing is that an entity, see there are two aspects. If you are sending one-to-one to your family, you can send it one-to-one to your family. There's no problem in that. The goods and services tax, even in that case, has been slashed from 28% to 12%. So that reduction has also been done. But let us say it is being sent to an entity or an NGO in India to work in a particular area or something. If these are the priority items, they can approach, as I mentioned, the nodal officer, get the certification, and then they can get the relief material and distribute it. It's a gift or donation item. That the key thing to note here is it's a gift or donation item which is coming from abroad, and it is being distributed free of cost for the COVID purposes. But in case you are feeling so, I think there is a general refrain that FCRA is causing a problem. I have also heard it from some people. But I would request that in case you have any specific issues or specific problems that are being faced by anybody, please do bring that to our notice, and the embassy or all our consulates will be very happy to check it out with the concerned authorities in Delhi and get back to you at the earliest.
Thank you, Anuragji. Thank you, Sureshji. Your willingness to just come before us and talk, and your openness, and I know that everyone is working under a great deal of stress. So please stay safe, please stay well, and we look forward to working with you and getting more done, as much as can be done from here for India. Thank you.
Thank you.
Appreciate it, Naresh.
Well, before I go, Shekharji, I have left my email ID as well as posted the details of the visa. For any queries and anybody or the participants or the relatives, family members, anybody, most welcome to write to me. And we'll provide immediate assistance.
Thank you. Thank you. That's what we want to do, is give people access so that they don't feel so alone and so difficult.
No, this is actually, this is something, we, a normal procedure which we used to have for the last 20, 30 years with the government has instantly changed for the last 1 year. So what we are experiencing, it is all complete new for us also, but we are providing service every day. We never were closed for a single day, even on the height of peak in the US.
Thank you. Thank you.
Thank you so much. Thank you.
So to move to the conversation, the open forums, please use the link that's provided in the chat. And let me end on a hopeful note by telling each of you that we intend to celebrate Vesak, Buddh Purnima, together with our Buddhist brothers and sisters. And in that hopeful note, we will ask each of you to light a candle at 5 p.m. on May 26th, which is the Purnima day. And we are asking this of all Americans and those anywhere in the world. We feel that it's a gesture that embodies peace, love, and unity. So please join all Dharmic communities and Americans in this simple act. And on now to our chat and breakouts, which I hope many of you will join, to say what can we do more at this moment of need for India. Thank you all very much for coming. We appreciate your time on a Sunday afternoon and look forward to seeing you again at another DHIA event.